So this is Dr. Scott Geller. It is the middle of November of the COVID year 2020. We have a lovely masked patient here. I don't know if that protects us so much, but it seems to be the appropriate thing to do. And she was referred by her very prominent ophthalmologist from Naples, Dr. Burley, and we thank him for that. You had a very simple, when did you have the onset of the floater?
When did it actually start?
Yeah, more or less.
I'm going to say back up north. Probably, let me get this straight now, around August or September, when I really noticed that it was not just a speck. It was a little bit larger than a speck floating across my eye.
And did you go to an ophthalmologist up there?
I did.
And did they tell you you had what was called the posterior vitreous separation or posterior vitreous detachment, or PVD? Well, that's exactly what you had.
They told me nothing.
Okay.
That I had a floater.
Oh, I don't know if you got your money's worth if they didn't tell you what was going on. But in any case, I'm sure they knew what was going on, but didn't communicate. You had a posterior vitreous separation. I like to call it that rather than detachment. Patients get confused because they know retinal detachment. And you had what we call a hyaline opacity, which it was annoying, and it was affecting your vision to a degree.
It affected my vision. Yes, it did.
Now, as unusual as it sounds, I'd say 95% of the patients I do require 2 to 4 sessions. And they often have more than what you had, and there's a reason for that. There's a limit to the amount of laser energy we want to put in. Mm-hmm. And we give it a little time between sessions to make sure we get any debris. But you say it's virtually all gone after one session?
Yeah, I get the little dots, but they're real teeny tiny, and they're sporadic. They're not constant like the other one was.
So in your case, rather than just jump in, and we just did the surgery. When did I do that? Last week? Last week, yeah.
A week ago.
And I've done 20,000 of these. I'm getting old at this, but just as skilled as I've always been. And I think the best course of action is let's see what happens for a couple of weeks. You're local, and there's no need to jump right into it. Every time you go in, there's always a very small degree of risk that you take, and we want to keep the risk to a minimum. But you are a happy patient, correct?
I am a very happy patient. I am so glad that they introduced me to you, because I can see so much better.
I like a happy patient. Happy patients. I mean, I wish I could say that 100% of the people are always happy, but this is medicine, and we do the best we can, of course. Well, thank you for being a great patient, and make sure you tell Dr. Burley what a wonderful job we did.
I will, and thank you. I don't know how to say thank you now. I told my friends back at the time.
You can let me borrow the Learjet. How does that sound?
Yeah. I told my friends back home that I want to take them out to dinner.
Oh, that's so sweet. Thank you. And have a great Thanksgiving.
I will. You also, Doctor. Thank you.